since last week, Saturday. Now, I can tell you guys for sure, see, doctor did not come alone. You know, he be not come alone. He be come with guests them, and they could join them anytime from. I just came to, made up like say they carry my doctor away from me. I said no.
Slimmest of them.
Doctor, good morning.
Good morning
sir.
to you.
How you doing?
I'm good. And
I like
you?
your blue. I'm very well, thank God.
Yeah, thank you very much.
So before I go, so it won't be like I'm not tapping from this anointing you're dropping this morning, doctor. What are we expecting on the show? I know it's still diabetes and COVID.
Yeah, thank you very much. Good morning, viewers at home and around the world. Tomorrow is the 14th of November, 2021. And this date, 14th of November, is marked or observed as the World Diabetes Day. This was as a result of a resolution that was passed sometime in 2006 at the United Nations General Assembly, okay, where it was adopted that this particular day be set aside for creation of awareness about the challenges that diabetes poses, the health implication to the whole of humanity. As we are talking today, nearly 500 million people are living with diabetes. And about half of those figures do not know that they have diabetes. And of course, the discussion today will be centered on all of this.
Okay.
The medical students first are Unilag, and are also retractors. I want to do the introduction. I want to start with the lady beside me. She is Retractor Sharon Ajudua. She's one of the past presidents of Rotaract Club of Medilag Golden. And also beside her is the current changemaker president, Retractor Princewill, Onyekah.
Thank you very much, my president. Thank you very much for having me.
I'm happy to welcome you.
Yes,
now,
thank you.
For the benefit of our viewers who may not know, I'm also a Rotarian. Okay, we belong to the same family. I'm the current changemaker president of Rotary Club of Ikeja South here in Lagos. Okay, so today they are here with me because of the program they have in commemoration of World Diabetes Day. Their program will be taking place today. I'll give them an opportunity to talk about that. But first, let's look at what World Diabetes Day is all about. World Diabetes Day was created in the year 1991 by IDF alongside WHO, World Health Organization. And since then, it has been a major platform that highlights the challenges of the public health importance, as well as the burden that this disease poses to humanity. And sometime in 2006, through a United Nations General Assembly resolution, Resolution 61/225, it was adopted that globally, every 14th day of November must and will be observed as World Diabetes Day. Why was that date picked? It was actually the birthday of a medical scientist that discovered insulin. I would like also to point out that insulin was discovered about 100 years ago. So this is the centenary celebration of the discovery of insulin. It was discovered by two medical scientists, Frederick Banting, whose birthday happens to be on the 14th of November, 1922, as well as Charles Best. These two individuals were the ones that played major role in the discovery of insulin sometime in 1922. Okay? And over 1 billion people usually get those campaign messages and awareness that comes from World Diabetes Day, scattered in 160 countries of the world. So the audience, the global audience is about 1 billion people are usually reached on this day through various programs that are being done by governments of countries and territories all around the globe. And this is World Diabetes Day. I have in the studio today the members of Rotaract Club of Medela Golden, and I will give them the opportunity to talk about the events they have for today in commemoration of World Diabetes Day that usually takes place on the 14th of November every year. I want to start with the lady close to me. Ladies first. So what do you have to say? Thank you.
Okay, good morning, sir.
Good
Thank
morning.
you for having me. Good morning, everyone. My name is Dr. Sharon Ajudua. I'm a final year medical student of the College of Medicine, University of Lagos. And I'm here with my colleague to enlighten us all on diabetes. Diabetes is a disorder of metabolism in general, and it involves a situation where there is absolute or relative absence of insulin. And so we have a lot of sugar in the body due to this. We have two major types of diabetes mellitus. You have type 1 and you have type 2. Usually type 1 affects the young mostly, and that is where you have an absolute absence of insulin. And by absolute, we mean that the body cannot produce insulin at all, probably because it's being attacked by substances we call antibodies. So the antibodies attack the insulin production in the body. Or it could be idiopathic, as we say in medicine. Idiopathic means that it is unknown. So you can say that type 1 diabetes is unknown or is due to antibody attack on the body. Now, for type 2 diabetes, we have a situation where the body might be producing very little levels of insulin. That's a decreased concentration of insulin in the system. Or a situation where cells, the fat cells, the liver cells, can be resistant to the amount of insulin in the body, and so as though there is no production of insulin at all. Okay, so we have some risk factors for diabetes, especially type 2 diabetes. It occurs in obese people, it occurs in elderly people, it occurs in a situation where there's a lot of cigarette smoking, use of alcohol. It could also occur in sedentary lifestyle. That's when you don't exercise as you ought to. Then we also talk about some features that you see. For example, you see people that have diabetes drinking a lot of water. You see that they always want to urinate, always. You see that there's a lot of weight loss. So these are signs and symptoms that you can see in people that have diabetes. So it's very important that we are really aware about diabetes because it is ravaging us in our system. And you can also see that after a long time of not treating diabetes as you should, you see that people come down with poor vision. They have issues with urinating as they ought to because now it's affecting their kidneys. You see a situation where they come down with stroke. You can have a heart attack because of lack of proper treatment. So it's important that we as Nigerians, it's important that we in the world at large take our healthcare very seriously and we put measures in place to abate this condition. Thank you very much.
Thank you very much for that wonderful overview. In fact, she has actually finished the presentation for today. Okay, but that said, I would like to give an opportunity to the current president, okay, to take from where she stopped.
Good morning, fellow Nigerians and then viewers all over the world. My name is Dr. Princewill Onyekah, the current Chainmaker president for the Rotaract Club of Medela Golden. So I can tell you all that I was working in a diagnostic center, and I got to see a woman who had an ulcerated leg, and then she didn't even know that she had a precondition, or she was predisposed to diabetes. She was saying that it was an ailment or probably an arrow from the people in our village. And then, you know, for me then, I was thinking about it and I'm like, oh, this woman doesn't even know that she has this. And then she was keeping it all along, not until it got severe. And then she had to come to the diagnostic center to do a Doppler, you know, on her leg. And then for me, I went online and then I had to Google. And then I figured out that, you know, we're not doing a lot. We're not doing a lot in terms of diagnosis, in terms of a lot of people are living with diabetes and we don't even know. So in Rotaract Club of Medela Golden, we want to solve problems. We want to solve problems, so we're problem solvers. And then today, we're raising awareness for diabetes. We're commemorating World Diabetes Today with an awareness walk from the Lagos University Teaching Hospital in Idiaraba to Ojuelegba Under Bridge. And after that, we would be doing a health outreach to screen people for diabetes, because we noticed that a lot of Nigerians, I think Nigeria has the highest population in Africa, and then a lot of Nigerians have diabetes and we don't even know. I can tell you one of the screening I did, there was this woman who she was looking healthy, and then before you know it, she has high blood pressure, and then she also had diabetes, you know. So what we're trying to do, we're trying to solve this problem, and then the International Diabetes Federation advocating that the Nigerian government need to see this as a condition that it is getting unabated at all. It's increasing daily. You know, like by 2045, we're going to have over 700 million people worldwide having diabetes.
25 years from now.
25 years, see, honestly. And Nigeria, what is Nigeria even doing? What are our governors? What is our presidency doing? What are our governors doing to reduce and ameliorate these cases? Yeah, the Ministry of Health. So we're calling for health policy makers. We're calling for change makers, drivers to help create policies that would help reduce this menace. That's one of the things we're calling for. And then we need to create access. Our team is access to diabetes care. If not now, when? If not now, when? That means in 2050, by 2050, we're going to be having a lot of people having diabetes if we don't cope. It's just like what we're talking with climate change and all of this. So, but if we're not going to create strategic moves, to see that these things reduce, this ailment doesn't affect people, then I don't know where we're going to go. So today we're going to have this done in Ajudua. We're inviting all Nigerians to come and take the opportunity of getting screened. Thank you very much.
Yeah, Lagosians, you have all heard him. If you're in Lagos, you have an opportunity to make yourself available. They are doing the screening at Ojuelegba under bridge. Okay, it affords you an opportunity to know your status. Remember, at the beginning, I pointed out that nearly half of the people that have diabetes globally are not aware that they have it. And 3 to 4 people that have diabetes in this part globally are found in low and middle income countries. Yeah. And that happens to be where Nigeria falls into. And nearly 500 million people today are living with diabetes, and we said that about half of them are not even in the know that they have this obnoxious medical condition. Okay? It's on that note that I want to say a very big thank you to Rotaractors that are here with me this morning.
Thank you very much.
Yeah, thank you very much. The current Changemaker president as well as the past president. I thank you all for coming. Okay, you've heard him. I would like to give you just 1 more minute, each and every one of you, to round up, and then whatever you have to pass across. So let's start with you.
Okay. Yeah. So as we have discussed, it's very important that we pay attention to the menace of diabetes because, as I said before, it's ravaging a lot of people, especially in the hospital. We are medical personnel, and we see how many people die day by day due to these complications. It's becoming very tough, and it's becoming very bad, and we need to be aware of the little things that we can do to abate it. Example, exercising regularly. You can do 30 minutes of exercise every day. And that would help abate the condition. And even if you have some risk factors, you can actually do a few things. Adopt healthy lifestyles. And when you do this, eat fruits and vegetables, eat less of fatty foods, you actually see that everything becomes easier. And you also help the doctors that are possibly managing you to manage better.
Thank you very much.
Yeah. For me, I would really want to channel my voice to policymakers to see this as a challenge, and then we need to beat it. If not, it will beat us. And then we have a lot of people coming up with illnesses, and then we will not be able we might not be able to cope it when it's still copeable now. But if we're not careful, it might get out of hand. So I'm calling for policymakers to please see this as a very, very vital problem, and then we need to channel resources, we need to channel fundings, we need to channel a lot of things to make sure that Nigerians and the world at large have access to diabetes care. Thank you.
Thank you very much. All in a bid to increase access to diabetes care. If not now, when? I can tell you that millions of people with diabetes do not have the knowledge of even how to go about the treatment, the diagnosis, and what they can do to prevent having complications that can sometimes come with uncontrolled diabetes. Millions of people globally cannot have access to the drugs that they need to manage this condition. Millions of people globally do not have access to the insulin that they may use, they may need to manage their diabetes. And these are some of the fundamental things that you need to have a very good diabetic control. A whole lot cannot afford to have a personal glucometer, which they're supposed to use all the time to check and have an idea of their glucose level in the body. Just like the medical students that were with us a while ago pointed out, they've told us what to expect. But for the benefit of viewers who may be joining us, let's talk about the overview of what diabetes is all about. One of my teachers referred to diabetes as suffering in the midst of plenty. Diabetes is a chronic condition that arises when the body cannot produce the insulin it needs to regulate the glucose in the body, or when the body cannot make good use of the insulin that has been produced.
That's poor processing.
Yes. Okay, so it has to do, everything about diabetes centers on this all-important hormone that is called insulin, which is produced in the body by the pancreas. In a situation where you have a total or near total absent production of insulin, it will give rise to the so-called previously described insulin-dependent diabetes, and that takes us to type 1. But in a situation where insulin is produced, but not in enough quantity that the body may need, or the body may be ineffectual in its usage of the insulin, it gives rise to type 2 diabetes, which is, of course, the one that is preventable. So 50% of diabetes type 2 can be preventable. And that is why this seminar, this awareness creation, this health education is important that we know so. And what can you do to be able to prevent yourself from having this? We have a caller, Elijah from Ogun State. Good morning, Elijah.
Good morning.
Yeah, you're on to the show.
Good morning, sir.
Yeah, good morning, my brother.
Okay, please go on with your question.
I have a question for you. I'm a diabetes patient.
Okay.
And type 2.
Did you say type 2?
Yeah, type
Okay.
2. Yeah, from Princewill on Ogun State.
Okay.
Yeah,
How old are you?
Type 2. Yeah, 37.
That's
Wow. You're a young man.
I've been using insulin for about 8 years now, or 9 years.
Wow.
20 years I have the diabetes. So I noticed one thing in my body, that my glucose is not working very well. So I don't know what causes it.
Did you say it's not working very well for you?
Yes.
Okay, thank you very much. I have an advice for you. Okay, I usually tell my patients that the control does not start and end with the use of drugs or insulin, as the case may be. There are a number of other things that you need to do to enable you achieve a good control of your diabetes. And one of them is diet. That's the most important one. You need to eat healthy. Even if you like, use insulin 20 times in a day, if you do not do dietary restriction, if you do not adhere to those dietary advices that we usually give from time to time, you will hardly be able to achieve a good control in terms of your diabetic control or glycemic control. Okay, so diet is important. You need to eat healthy. Okay, we'll dwell more on diet, but let's look at other factors that you also need to.
I'm sorry, sir, because my question is quite related to what you just asked.
Okay.
I mean, I heard when he said that he's been living with diabetes for the past 8 years, and it's just 37.
He has been using insulin for the past 8 years.
Okay, so does it have anything to do with age?
It doesn't have, you know, when we talked about the types, different types, they have to do with age, but that is not to say that they are absolute. Okay? For instance, type 1 are found, type 1 diabetes is usually found in people who are much younger, young adults, adolescents. While type 2 is usually found in older adults. Okay? So with the age, one can have an idea of the type of diabetes an individual may have. Okay, but he is 37 years from what he told us, and he has been using it, using insulin for 8 years. So thereabout, he didn't start using insulin at the beginning. Okay, so he must have picked up the diabetes along the line. And of course, I'm also happy that he also knows the type that he has. Okay, so some other things that one will need to do is to inculcate exercises in your daily activities. It's recommended that we should all exercise for at least 30 minutes over a period of 5 days in 1 week. You can't afford to continue a life of inactivity, sedentary lifestyle. Those are one of the predisposing factors, risk factors that can actually make one to have diabetes. Or if you already have diabetes, it can actually affect and predispose you to having some of the dreaded complications that nobody wants to have, that could come with uncontrolled diabetes. Remember, diabetes can affect virtually all the organs of the body. If it affects the eyes, it can cause diabetic retinopathy, which could come with impaired vision and sometimes blindness. 2 to 3% of causes of blindness globally can be traced to diabetes, and people do not know. It affects the nerves in our bodies. It affects the blood vessels. If it affects the nerves, when it is uncontrolled, it could give rise to all sorts of problems. Peripheral neuropathy, in which case the person may have challenges having or being able to feel things around. It can affect the kidney. It can cause diabetic nephropathy. Okay? When it affects the nerves, sometimes in men, it can lead to erectile dysfunction. And it can also lead to impotence. So it can cause a whole lot of complications when it is not controlled. It can lead to stroke. And of course, coma and death in some instances. So that is why we need to, if you already have diabetes, you need to start doing some of these things that we are pointing out. Okay? So that takes me to symptoms of diabetes. What are the symptoms of diabetes? Type 1 diabetes. The symptoms in type 1 diabetes are usually very well noticeable. Okay? In a situation where somebody who has been apparently normal, all of a sudden you just discover that you have started drinking water excessively, you can go to pee within a space of 1 hour for four times or more, of course you'll be disturbed. So the symptoms are usually easily noticeable if it is type 1 diabetes. And that can include weight loss, vision problems, increased thirst, increased urination, polyuria, increased urination at night, okay? Loss of energy, weakness, unexplained loss of energy, okay? These symptoms can equally be found in type 2, but they usually appear over a period of time, and that is why it is not easily noticeable, okay? And that is why today we say that 1 out of every 2 persons that have diabetes may not even have an idea that he or she has diabetes. Okay, so these are some of the symptoms it can cause. And we have said before that there are majorly about 3 types of diabetes. There are some other types which we may not want to bother you with. But these 3 major types are type 1, type 2, and of course, gestational diabetes, which has to do with pregnancy. people who were not, or women that were not previously diabetic, on becoming pregnant, somewhere along the line, they could pick diabetes. Okay, so that's called gestational diabetes. And
why is it based on what's responsible for that, doctor?
Mostly, it could be traced to, of course, lifestyle,
okay.
Some of the risk factors that we have talked about, becoming obese, becoming overweight, and all whatnot. And sometimes too, hereditary and genetics could also play a role.
Okay.
And women who find themselves in this condition may have a number of complications with childbirth. Number one is that they are prone to having babies that are macrosomic, babies that have big weight, that weigh more than 4 kg. Okay, sometimes they could even have babies dying in their womb. IUFD, intrauterine fetal death, diabetes can cause all of that. Okay, they could have challenges with delivery because of big babies. They may not be able to achieve vaginal delivery, so emergency cesarean section may be an option for them. And even after delivery, in 10% of them, the diabetes may not resolve. And it is also a risk factor for such an individual to develop type 2 diabetes later in life. Okay, so that's why we need to avoid some of those things. Suffice also to say that these risk factors that we are talking about, some of them are avoidable, while some others are not. Okay, so let's look at them. Modifiable risk factors. Okay. What are they? The modifiable risk factors for diabetes are the ones you have a say, the ones you can do something to stop. You can afford, yes, you can control. The one that is within your control, that is the right word. Okay. For instance, you can control what you eat. You have a control to either shed weight, lose weight, or take measures, take steps to maintain a healthy weight, a good weight. We talked about BMI last week, and we also did our calculations. Okay, just as a reminder, that BMI is an important tool that will help us to assess our weight. We have a caller coming in.
Yusuf from Kogi, good morning. Yusuf. Hello, Yusuf. Yusuf. Is he there? Okay. Please feel free to call us back. Of course, Dr. Side here, ask him questions really relate to what we discuss. This morning, numbers they on your screen, 08173147589. Of course, 08105434984. Please continue, sir.
Thank you very much. So there are measures we can take as individuals. There are also measures that we expect governments, national governments of countries to also take. But let's narrow it down to the ones we should take as individuals. For instance, we give the formula of calculating BMI, and I want to just repeat it very quickly for those of us who may have missed our program last week. Now, the BMI in full is body mass index. It gives you an idea of whether your weight is good or
you need
not.
To watch it. Elijah from Ogun. Yeah. Hi, Elijah. Good morning.
Good morning.
Okay, please go on with your question.
Yeah. About the is this any drug can I be using apart from the insulin?
We didn't get you. Come again.
He said apart from the insulin.
Okay.
Can I be using any other drugs? I can stop for the insulin. Can I stop the insulin? Can I use the drug?
Okay, thank you very much. Thank you very much. What I will advise you to do, but I will give a general answer to your question, but I will advise you to go and see your doctor. They will need to monitor your sugar level and then find out why you're not having, for the benefit of people who may be joining us, he has called earlier. Yeah. He has given us a pre-information. He's diabetic. He has been on insulin for the past 8 years. Okay, so I will advise that you go and see your doctor. They will look at, your doctors will look at how good your sugar control has been in the last 3 months. There is a test that can be done to give you an idea of your sugar control in the last couple of months. It's called glycated hemoglobin, HbA1c. That test can give you an idea of your sugar control in the last 3 months. Now, if they do and are not getting the results that they want to get with respect to your control, they may add a drug to the insulin that you're taking. That is possible. In some situations, we may combine insulin, the use of insulin with some medications. David from Lagos, good morning.
Good morning, doctor.
Yeah. How are you today?
I'm fine.
Yeah, please go ahead.
Please, if someone wants to lose his weight, what will somebody do? I have big tummy.
Thank you very much. Thank you very much. Thank you very much. It's not funny, but I like the sincerity that you have brought to, that your question has brought this morning. A lot of us have the same challenges. And one of the risk factors to developing type 2, one of the risk factors that can push anybody to develop type 2 diabetes is what we refer to as truncal obesity. Truncal obesity. If your waistline, if you take a measurement of your waistline from your navel, from your umbilicus, around your waist, if it's beyond a certain limit, you have truncal obesity. And that is one of the risk factors that can make you have diabetes 5-10 years down the line if measures are not put in place. Okay? But to go to his question, what can he do to shed weight?
Exercise.
Number 1 is exercise. Number 2 is diet. Okay? These 2 major factors can actually do a whole lot for you. I also do know, that was why I was silent in mentioning it, there are a number of herbal preparations, supplements that people claim that they can help you to shed weight. Okay? I may not advise you to go on any of them because except if your doctor prescribes such for you. But the 2 important ones that you need to use is curtail what you eat,
and
eat healthy, and exercise always. You can join a gym class if you have the time. But even if you don't have the time, you can develop these things at home. I've talked about that we shouldn't wait till we have all it takes, get prepared to go on the road, go to the stadium to do exercise. It could be in your office. If you have the time, you can do the staircase in your office a couple of times. If you're in the house, if you're back from work, you can do jogging, dance to a music for about 30 to 40 minutes. They're all forms of exercise. You can go on swimming. You can do walking. You can do a workout. It could be done in a number of ways. There is no formula for exercise. Okay, so just keep doing it.
Can you even do it online? I mean, these days
Yes.
you have videos that you can
Yes,
play and
that
you
can
just
guide
right
you.
your comfort zone.
Aerobics.
Yeah.
They are wonderful. When you do it and you sweat, you go and have your bath.
Yeah.
Even if you're diabetic, it helps you to achieve a good sugar control. Okay, so it helps you to achieve a good sugar control. So we're still talking about the modifiable risk factors, the ones we have a say. Okay, and we talked about diet, we talked about avoiding sedentary lifestyle, we talked about avoiding life of inactivity. Joshua from Nasarawa, good morning.
Good morning, sir.
Yeah, good morning.
Joshua, go on.
They said they are talking about diabetes.
Yes.
Yeah.
So, I want to know the.
Turn down your volume, Joshua.
Please, I want to know the insulator and what causes diabetes and the sample, the size.
Thank you very much. He wants to know what causes diabetes. And he also wants to know the types. Okay? What causes diabetes? I will take them one after the other. In type 1 diabetes, the cause is not known, but it is believed to have something to do with the autoimmune destruction of the cells of an organ of the body that is called the pancreas. That pancreas is one that produces insulin, which is a hormone that regulates blood sugar. So in a situation where you have those cells that are called beta cells found in the pancreas, the body, for one reason, for reasons not yet clearly known, the body system destroys these beta cells found in the pancreas, thereby incapacitating the body, making the body unable to produce enough quantity, or in some cases, making it unable to even produce at all. If it makes it unable to produce at all, in a very little or minute quantity, we have type 1. John from KB, we'll come back to your question.
Good morning.
Yeah, good morning, my brother.
John.
Yeah, good morning, doctor.
Yeah.
Yeah, I have a question.
Yeah,
I know
please go ahead.
it might sound somehow, but you're talking about exercise. So, there's this thing we used to hear that said sex burns lots of calories. Is it part of an exercise or something? I just need to confirm that if it is true. We do hear it a lot, but we just need to confirm that if it's true or not.
Thank you very much. That's a very good question. But I can tell you that anybody who is not fit enough cannot perform, okay, when it has to do with coital exposure, as we do call it in medicine. If you're not fit, you may not be able to function in that capacity because it involves rhythmic movement of some parts of your body. So it should be, I think so, and it should be part of exercise. Okay, so that's my opinion on that.
Yep.
Okay, so back to the types. In response to the question that came from a caller from Nasarawa. Okay, so when we do not take measures to bring down our weight and we become obese, we smoke, we eat anyhow, we can predispose ourselves to developing diabetes. And that type of diabetes is called type 2. Okay, so the risk factors that can predispose one to develop type 2 diabetes: smoking, weight gain, obesity, overweight, sedentary lifestyle, and a whole lot of other ones. Okay, for a woman who may have suffered gestational diabetes somewhere along the line, is also a risk factor for developing diabetes some years down the line. Okay, and then what are the symptoms? We've talked about them before: frequent urination, weight loss, unexplained fatigue, blurring of vision, exposure to infections, easy bruisability. Our skin becomes easily injured. In some cases, a diabetic person may have an injury on the leg may be bleeding, the person may not even be aware. Okay, so
but why is it that they most times tell them to prevent having injuries?
Poor wound healing usually happens in people who are diabetic. Okay, so if a diabetic gets to have an injury anywhere on his or her body, if the person does not achieve a good control, that injury may not heal over a long period of time. And that is why oftentimes you see us talk about amputation. Those are some of the complications. People losing limbs as a result of diabetic complications. Okay, so all of this can happen. Okay, but for the non-modifiable risk factors, which will include the age, the genetics, the family history, the race, and what have you, we'll stop.
Are we going to continue again next week?
Yes, of course we're going to continue, because World Diabetes Day is still tomorrow.
Okay, all right. So thank you so much.
So by next week we should be able to talk about treatment.
Okay, so we'll do treatment next week. That means you know we won't miss the show. Thank you so much.